Rootcode has been a true partner for Truentity. Rootcode was able to sort of help us, when we were really small, and they came in with, a few number of resources. And one of the great things is, the elasticity of the resources that we can access. So Truentity Health is helping community pharmacies in the US transform to clinical hubs. So what has happened over the last several years is pharmacies such as Amazon Pharmacy and CVS's and the Walgreens of sort of that market has really started to take away a lot of the market share because everyone sort of has started to go online with respect to pharmacy prescriptions. So these community pharmacies are under a lot of pressure to diversify their business. So they are now looking to provide more clinical services to their patients, and they're looking for help to get their technologies in place to be able to do that, and also their workflows. So we at Truentity come in and help them transform and become a central part of providing the care to their patient population. Yeah, so Rootcode has been a true partner for Truentity. Rootcode was able to sort of help us, when we were really small, and they came in with, a few number of resources. And one of the great things is, the elasticity of the resources that we can access, and the talent that you have here can sort of work. It can work with us on a sort of a as needed basis. So as an example, we do full stack work, but sometimes we need more help during UI UX phase of the project, and then we can access your talent. In other times, we may need more DevOps related talent, so we can sort of access that as well. So that has been truly an important aspect of our partnership. But the other aspect is Rootcode has really helped us, even when we were not doing well, and has been a true partner in that sense. So I'm really happy that, we've partnered with you. So we are building a platform, a software platform, working with Rootcode. There are other aspects to our business as well, which involves a lot of workflows and medical billing and medical contracting that may not come into the platform yet. But right now with Rootcode, we are completely focused on this software platform that we are building for the community pharmacies. This platform is, fairly complex because, we started with something very basic, but, we've been adding many integrations in the back end. We've added, additional data sources, and the data sources in healthcare in the US are extremely complex, and you have to sort of know exactly how to access them and to actually build the workflows that can help the end pharmacists, provide the care that, we have as a feature in our product. Other than that, the patient engagement aspect of the platform is really important. And in that aspect, we use a lot of communication-based technologies, where it's about calling a patient or texting with a patient. So there's, that complexity there. And, now we are working with you all on the AI side of the things. And, we are so fortunate to have, your partnership there, because you all have done some amazing work there, and we are truly excited about getting the AI feature going on our platform as well. So yeah, I'm really happy that I'm working with the team that Rootcode has here. Each of the engineers is an extremely hardworking and dedicated engineer, who likes to learn a lot, and also works with us, on the customer front as well. They're not just working in their sort of cubes in only the technologies work, but they're really curious and interested in how the work that they're doing is impacting or having an impact, on the customer and on the patient. So the information that I work with in terms of the workflows and the patients, I'm able to sort of communicate here, and that's one of the reasons I also wanted to come here and sort of be able to work with the team to bring them into the fold on a lot of the aspects that they may not see day to day. So remote patient monitoring is one of the key elements of our platform, where we provide the devices to the end patients. These devices help measure blood pressure and glucose. And typically all these patients are older patients with diabetes and hypertension, and we collect all this data, and then we manage the data, and there's a lot of workflows. So again, like the engineering team here has really understood how the features that we are putting together are being used by our customers. So, and we've got a lot of other processes that we put together, where they work with us in making sure that whatever the features that we are putting together are not getting duplicated and are not something that are not needed and things like that. So it's been a really great collaborative work that I was able to do with the team here. So I'm really glad that Rootcode is our partner.